Hello, my name is Cam Lindo, and my presentation is titled Beyond the Headlines, the Hidden Arm of Neurohype. What is neurohype anyway? Neurohype is the exaggerated presentation of neuroscience that makes early results appear more accurate or advanced than the actual evidence supports. We will be looking at how scientific discoveries are impacted by neurohype, whether being amplified or simplified for public consumption, and why this matters to patients, doctors, and researchers. How has the media narrative around neuroscience changed over time? Historically, phrenology was a 19th century pseudoscience, claiming that bumps in the shapes of the skull could potentially reveal personality traits, give insight on intelligence, and moral character. This idea was heavily promoted by scientists through newspapers and books, which helped it gain credibility amongst the public. The most notable case was a gentleman named Harry T. Hayward. He was a convicted criminal whose skull was measured after his death. Scientists and authorities claimed that based on the shape of his skull, it provided them evidence of a degenerate criminal mind. This shows how early neuroscience claims, even completely unfounded ones, were presented as scientific fact and heavily shaped public perception. Thankfully, with new discoveries in the early 20th centuries, our understanding of the brain grew, and these ideas were gradually phased out and lost credibility. Today, we are still experiencing similar problems and seeing a similar pattern with new technologies emerging in neuroscience. Media coverage of brain-computer interfaces, psychedelic therapies, and treatments for neurodegenerative disorders are often suggestive that there are major clinical advances that are ready for mass implementation. The articles covering these discoveries imply that these tools are ready for use even though they remain in early stages of research. Most notably, a 2024 study looked at how brain-computer interfaces are described in the media. They found that BCIs, particularly ones that could be implanted, are often framed as therapies that will restore communication or mobility for people with severe disabilities. This type of coded messaging emphasizes patients can regain independence and receive transformative benefits, which gives the impression that the technology is nearly ready for clinical use. In reality, most BCIs are still in early experimental phases, with many unknowns surrounding particularly safety, effectiveness, and ethical implications. This continuity from past to present shows that neurohype is persistent and continues to influence how the public imagines the potential power of neuroscience breakthroughs. The overarching question here is, how does the portrayal of neuroscience breakthroughs in the popular media impact patients' expectations and experience of clinical care? This project examines how neuroscience discoveries are often transformed as they move from the laboratory setting into public headlines. The language used in that transition shapes how the public interprets scientific research and medical possibilities. When the initial data is reframed as a definitive solution, patients stop receiving information and start receiving promises. The communicative breakdown has real ethical consequences. It weakens patient autonomy and distorts decision-making in the clinical setting. My focus is on understanding how this distortion happens, the impact it has on patients, and proposing ethical ways to make scientific communication more honest and accountable to the public. What does the research tell us about emerging neurotechnologies, media hype, and the impact on patients? Well, neuroscience naturally captures attention because it feels innovative and people are fascinated by the brain since it's central to our identity. Many neurotechnologies mentioned in the media today, like brain-computer interfaces, deep brain stimulation, and psychedelic-assisted therapies, show real promise. In the research setting, they can produce measurable changes in brain activity or behavior, but most studies are in early phases, with small selective sample sizes and short-term follow-ups, meaning the long-term outcomes, safety, and the lasting benefits and or effectiveness for broader patient implementation is still uncertain. Despite these known limitations, media coverage often presents these technologies as if they are already proven treatments. One reason the public is so easily influenced is a phenomenon known as seductive allure. To prove this, in one study, participants were given explanations of psychological phenomena that either included irrelevant neuroscience details, such as mention of brain regions or neural activity, or the participants received no extra information at all. The findings showed that the explanations with neuroscience references were consistently rated as more satisfying, credible, and trustworthy, even though the neuroscience information given had absolutely no bearing on the research being conducted. This goes to show that brain images, technical terms, and mention of neural processes make findings seem more believable, which is why these exaggerated reports of early results can strongly shape patient perceptions. The impact on patients can be serious. Research found that patients need accurate information, their understanding should be checked regularly, and the expectations and benefits and risks should be realistic. When media hype exaggerates recovery or potential enhancement, these guarding characteristics can be undermined or overlooked. Patients may even believe that experimental interventions are already proven, which can affect their decision making and cause frustration when the results don't meet the expectations they went in with. Neurohype is far more than a communicative issue and has real clinical impact on patients' experience and the overall trust people have in science. To remedy this, accurate, open, informed communication is key. Research findings and experimental treatments should be presented clearly, accurately, and within context, so patients understand exactly what is known and what still isn't proven yet. Clinical researchers have the burden to explain the limitations, potential risks, and disclose the stage of development that the technology is currently at. This will help ensure that patients can give informed consent. The responsibility is also on the media to report essential and accurate elements of the research without exaggerating or oversimplifying the findings. Lastly, promoting health literacy and patient understanding also helps people critically evaluate claims and know how to tell when an article is playing on their vulnerability. This will help increase the overall trust in science and healthcare. One stance those opposing my position take is that hype in neuroscience can help draw attention to research and increase funding for scientific projects. A large-scale study reviewed thousands of grant proposals submitted to major funding agencies. They found that proposals using more promotional language such as innovative, groundbreaking, or unique were more likely to receive funding. The study also conducts a linguistic experiment showing that replacing promotional terms with the natural terms reduce reviewers' enthusiasm. This suggests that language alone can influence the decision to have a project funded or not. Another stance is that optimistic narratives can help motivate patients. In a multi-center study on cancer patients, researchers tested an educational intervention that explained what clinical trials involved and addressed common concerns and misconceptions. They found that patients who received this intervention showed significantly more positive attitudes towards clinical trials and greater willingness to participate compared to those who only received the standard printed informational brochure alone. This shows that when research is presented in a clear, accessible, reassuring way, it can improve patient morale and increase their willingness to participate in research. The last claim is that researchers need public interest to sustain innovation. In a study focused on startups that received exponential media attention, showed the more media coverage a startup received correlated with the amount of venture capital funding they were able to attract. They claim that investors use media visibility as a signal of potential success, legitimacy, and future impact. We see this reflective in the way current neuro companies push to have groundbreaking media attention that help push their brain-computer interfaces and neural implants. Some people argue that exaggerating findings is okay if it increases engagement, but research shows this is overall misleading. In understanding the problem of hype, Intamin explains that sensationalization science can distort public understandings. She gives examples where preliminary results are presented as major breakthroughs, which can mislead people about what is actually known and make it harder for them to make informed, ethical decisions about their healthcare and participation in research. Hose and colleagues provide empirical support for this. Their study exposes participants to either accurate reporting or media coverage that exaggerated findings. The results of this was misleading coverage, even when based on real science, reduced the trust in scientists and scientific institutions. This shows that both false information and overhyped claims can have long-term effects on public confidence. Overemphasizing optimism can also be harmful when potential benefits are presented as more certain than they really are. This creates a sense of false hope. Mushenga explains that false hope occurs when expectations are not based on solid evidence, rather they're based on ignorance or misrepresentation of facts. In the medical setting, this kind of false hope can undermine informed consent because patients may believe a treatment is likely to work even when there is no data to support that. Keeping expectations low and realistic support informed consent, help make patients make better decisions, and reduce emotional distress associated with patients expecting different outcomes than what the science can actually produce. This is often the result of presenting preliminary neuroscience research that has not had the time to be properly investigated and the long-term effects haven't been accounted for. Lastly, in a recent study by Stephanie Miramis, researchers from different fields and career stages were asked how competitive funding affects science they conduct. Many participants reported that funding pressures pushes scientists towards more predictable projects that will deliver quick results than favoring easily fundable work over potential meaningful research. This is described as projectification, where science becomes a series of short-term grant-driven projects instead of a long-term effort aimed at tackling a deep question or problem. As a result of this, ambitious or seemingly risky research that may take years to produce results gets sidelined, even though this type of work is usually more meaningful and the foundation of true scientific breakthroughs. Merriman's notes hype-driven funding and the pressures to promise big results push research away from careful foundational work. This weakens the stability of science and makes transformative discoveries less likely. Patients being affected by neurohype is an ongoing cycle as healthcare becomes increasingly technologically driven. Trust will become its most fragile and essential resource. As demonstrated throughout this project, responsible reporting is not optional. It is ethically necessary for protecting patients and sustaining the future of credible, evidence-based healthcare. Thank you, guys.